Patient volumes at some Northwest hospitals are soaring. Because of the high numbers, Governor Jay Inslee put a pause on non-urgent medical procedures in Washington.
That means patients are once again playing the waiting game with serious health conditions. Fox 12's Camilla Ortiz joins us live in Vancouver with more on that. Camilla?
Yeah, Governor Inslee made that announcement yesterday, pausing elective procedures for 4 weeks. That gets us up and over the predicted peak surge or peak of this Omicron surge. There's no Oregon order in place, but we know that hospitals there are also scaling back on non-urgent care. It's a potentially scary situation for people facing serious health risks.
It's easy to not see it if you're not immediately interacting with it or if you don't need health care. But when you do need it, you're going to notice it.
Tim Farr with the Washington State Hospital Association says medical centers in the Evergreen State are once again overwhelmed.
We have hospitals that are surging past what they typically would accept in terms of patient volumes.
Governor Jay Inslee's emergency order announced Thursday pauses whatever physicians deem to be non-urgent procedures for 4 weeks. This is to help relieve some of the strain on hospitals. This hits home for Farr, whose 1.5-year-old son was on the books to have a hernia removed.
Like literally we were expecting the phone call for like, when do we have to stop feeding him food overnight? And then all of a sudden it was, oh, your surgery has been canceled. We don't have an estimate on when it's going to be resumed.
According to analytics experts in Oregon, the light at the end of the tunnel is getting closer.
3 weeks.
A new report from OHSU shows the impact behavior shifts are having on the forecasted peak in hospitalizations.
We had anticipated some change in behavior, but it's actually happening quicker than we expected.
Dr. Peter Graven, who heads OHSU's analytics office, says new numbers show the peak would have gone up to 2,200 hospitalized patients by January 28th, had people not reduced their social interactions. Now that number is closer to 1,600, 600 fewer occupied beds. He says what we do in these next couple weeks can continue to improve the outlook.
It's really the behaviors that you do tonight, tomorrow, all those things are going to make a difference.
Governor Inslee had a similar message, adding that the problem with Omicron comes down to supply and demand, less healthcare staffing available because more nurses and doctors are getting sick and more patients needing care. Reporting live in Vancouver, Camilla Ortiz, Fox 12 Oregon.